Perfect, perfect. Thank you. All right, I think we shall start. It is 2 minutes past one already, ladies and gentlemen. Thank you very much. My name is once again, apologies for being muted there. My name is Loretta Lechman. Good afternoon, and a very welcome to this year's 2026 product overview. So I'm Loretta Lechman from the Member Relations and Temple Wellness Department. I hope you're going to enjoy what I am going to present to you this afternoon. So, if you have any questions, ladies and gentlemen, you're welcome to ask that on our Q&A functionality. We do have a panel this afternoon with me that will be able to assist you with any of your questions, whatever questions you might have. You are more than welcome to ask those there, but please be mindful. Any personal questions, any member numbers or ID numbers are not allowed because everyone will be able to see that information. So general questions will be permitted. If you have personal questions, claims, queries, etc., you are welcome then to email us at engagements@bestmed.co.za so that we can answer all of those personal questions, because we will need your member number and we will need also your ID number to look into your profile. Also remember that there are some queries that we might not be able to answer here on the platform, and we will get back to you should we not able to answer those questions. All right, like I said, I do have a panel with me this afternoon. So I've got the ladies from our PMB and chronic department, from our hospital benefit management department, from our call center, our provider relations department, as well as the member experience department. A very warm welcome to the team as well. Some house rules. Please check if your sound is up. All right, if you can hear me. If you can't hear me, you're welcome to leave the session and log back in. Then you should be able to hear me then. And then also your mics will be muted because we do not want any interruptions during the session. We will take questions after the session. Should you still have questions after the session, we will also be sharing the recording with you, ladies and gentlemen, after the session, as well as the presentation for you to go through it on your own time, and maybe email us if you have any other uncertainties. All right, thank you so much. Moving along. So we will be looking at first at a Bestmed financial highlights, what has happened in the past 2024 to 2025. So currently, as at the 31st of December, principal members stands at 121,707 with a total beneficiary count of 250,320. Our claims ratio as at July 2025. So those of you who do not know what a claims ratio is, the claims ratio is the contribution versus the amount of claims that we are receiving. So with the contributions, we were able to pay 86.1% of claims. The solvency ratio as at July is 33.48%. The net contribution income as at July 2025 is 13.83% up on 2024. Healthcare expenditure at July 2025, expenditure went up 4.47% compared to 2024. And then our net healthcare results year to date is 268 million. Our weighted contribution increase for 2026, that which we all are waiting for so eagerly, is 6.8%. All right, so this is a huge decrease compared to what we had last year. All right, so just to see what happened over the past few years, we can see 2021 during the COVID period, we went to 4% and then 3.9%, 2023, 8.5%, 2024, 9.6% average contribution increase. And then 2025, because of the low contribution and the claims that we've received, there was a need for the scheme to increase the contributions to 12.75. And then we can see with the claims rate that I've just mentioned, the slides before, we can see then this year we were able to bring that down to almost half of the contribution that was introduced last year. So the increase for this year is a whopping 6.8%. I am hoping that all of us are glad about this and that 12.75% was a bit too steep, but yeah, we managed to do well this year. So therefore, the lower average increase. Right, so contribution overview for the different options. The Beat One network, so your contribution will be increased by 7.5%. The non-network Beat 1 to 7.5% as well. Beat 2 and Beat 3, both also 7.5% on the network and the non-network options. Beat 3 plus 5.2%. Beat 4, 7.8%. Phase 1, 5.1%. Phase 2, 7.8%. Phase 3, phase 4, the same 7.8%. And then the rhythm 1, 7.5% and 6.1% for rhythm 2. So that is the average contribution increase percentages for the different options. Right, so 2026 contribution overview for B3 Plus and Phase 1. We can see here the 5.2% average is the member, 4% increase there, adult dependent 7.5 and child dependent 7.5, which shows us then on B3 Plus, the main member, that contribution or annual contribution, monthly contribution will then be 5,042 Rand per month for the main member, the adult dependent 3,746, and a child dependent will be contributing 1,902 Rand. Phase 1, 5.1% average, which means then 4% increase for the main member, 7%, and 7% for adult and child dependent, which means then the Rand value will then be 5,934 Rand for the main member. Adult dependent will be paying 4,289 Rand, and a child dependent 1,541. Right, on the beat range, we do know that our beat range is our affordable hospital plans that covers both in and out of hospital expenses with a variety of day-to-day benefits as well as preventative care benefits, right, such as preventative dentistry. So if you have not done your dentistry yet, please go and clean those teeth. Female contraceptives as well is also forms part of the Bestmed preventative care benefits. Right, so looking at what is happening next year for 2026, on the beat range, we have increased the take-home medicine limit, right? So we do know when you are hospitalized, you have a 7 days of maximum treatment of medication when it is claimed as part of the hospital account. So a maximum of 7 days of treatment is covered on the hospital account, and a limit is applicable if it does not form part of the hospital account. So that limit has been increased. Right. So it means then when the doctor is writing out a prescription, that limit for bit 1 and bit 2, your prescription from 250 now has increased to 450, bit 3 and bit 3 plus from 250 to 500, and bit 4 to 550 Rand. So that is to fill your prescription on the date of discharge. If it is not claimed on the date of discharge, ladies and gentlemen, as a reminder, you will forfeit that 500 Rand. So it is best rather to advise your doctor to give your medication. If it is late in the evening, late in the afternoon, you won't have time to go to the pharmacy, or the pharmacy might be closed by the time you get discharged, for doctor to please add that TTOs to your hospital account. Otherwise, if you do not use your 450 or 500 or 550 on that day of discharge, you do forfeit that money. So just be careful about that, or be wary about that. There's also an increase in cochlear implant and bone-anchored hearing aid benefit. So for cochlear implant and bone-anchored hearing aids, the implant limit has increased on beat 4, still 100% off the scheme tariff to a limit of 250,000 Rand per beneficiary per annum. And these fees includes providers and hospital and the device. Okay. Then separate, the intrauterine device is limited under the female contraceptives benefit. It does no longer form part of the overall contraceptives benefit. Right. So it is now two separate benefits. So you get your oral or your injections or your patches. That is a separate benefit. And then you get your IUD, which is separated now from that benefit. So on bit 1, you have a separate benefit of 3,295, bit 2, 3,595, bit 3 and bit 3 plus 3,795, and bit 4, 4,225 for the IUD. And remember also, ladies, you can have one or the other. And if it, for some reason, the IUD does not work, because we do know that sometimes life happens and our bodies does not react well to certain medications or devices in the body, then you are welcome to contact the scheme so that we can advise you what to do after that, should your IUD not assist you with your contraceptive, or the pill or injection does not help with your contraceptives. Right, then also the 2026 benefit enhancements for the IUD, like we said already, it is now across all of the options separated. So we can see here the contraceptives benefit on bit 1 is 2,092 Rand, then the IUD 3,295, bit 2, also 2,092 for your contraceptives, the annual limit, and then 3,595 for the IUD, and then both B3 and B3 plus, 2,510 for the contraceptives, the oral or injection or patches, whatever you're using, and then 3,795 for your IUD, bit 4, 2,800 covered there, and 4,225 is covered for your IUD. Right, colon cancer screening, that is added to the colon cancer screening as a preventative care benefit once every 24 months for beneficiaries 40 years and older. Then HIV rapid testing, added HIV rapid testing as a preventative care benefit once every 12 months at a designated service provider. So we do know that Bestmed do make use of designated service providers, which means the DSP stands for designated service provider, which means that on our website, you will find a list of hospitals, doctors, GPs, specialists, pharmacies, optometrists, whatever you need. Those doctors are and hospitals are on our website. And you, for your own benefit, you need to consult those for your own benefit. Do not pay any extras or co-payments or anything that we would not want when we go outside of the network. Prostate-specific anti-aging screening for the gentleman on beat 1, the age limit has been lowered now from the age of 50 years to 45 years on all of the beat options. So on bit 1, I just want to reiterate that this has been added onto bit 1. All right, it was never included on bit 1, but now it is added on bit 1, which meaning now that it is covered on all of our bit options. Right, just an overview of the bit 1 option. Unlimited hospital cover stay for theatres, consultations, your procedures. And please do remember to contact us 7 to 14 days before you get admitted. And for those of you that are on the network options, if you're going to voluntarily make use of a non-network hospital, there will be a co-payment applicable of 15,025 Rand per event. Day procedures, also remember there are procedure specific co-payments, and as well when we go to a private hospital for our day procedures, also keep in mind, as we've been communicating all year long, that when you go for your day procedures, and these day procedures like your colonoscopy, gastroscopies, they are done in a day hospital, and there will be a co-payment applicable should you then make use of a non-DSP, voluntary use of a private hospital instead of a day hospital, right? So your day hospital is basically where you get admitted for also, it can be emergency or short-term visits, such as you go for in the morning, 6 o'clock for your gastroscopy to be done, and by 10 o'clock or 12 o'clock you are discharged. So that is what we mean by a day hospital. No overnight stay is necessary for day procedures. Hence, if we go into a private hospital and you might need to stay over or anything of the sort, then that co-payment will be applicable, right? The list of day hospitals are also on the Bestmed website. GPs and specialist consultation on bed 1, there is no benefit, right? The specialized diagnostic imaging limit has been increased to 20,920 for the family, and has communicated it is for both in and out of hospital. So the limit is for, you can use it whether you are out of hospital or in hospital, right? Then co-payment there is 2,600 Rand per scan for your MRI or CT scan. And then the co-payment is not applicable for PMBs, right? For any PMBs, the co-payment is not applicable. Maternity care cover for birth at 100% of the scheme tariff include your C-section and natural birth. You get 6 antenatal consultations with your GP, midwife, or gynecologist, 2 ultrasound scans, the first trimester and the second trimester at your GP, gynecologist, or your radiologist, your take-home medication, as I've mentioned before, 7 days of treatment if it is claimed as part of your hospital account, or 450 Rand for your prescription to fill on the day of discharge. You also got access to 27 chronic conditions and 17 PMB conditions, and making use of non-formulary medication has a co-payment of 30%. Hence, I've also mentioned we do make use of certain designated service providers. So, for example, Clicks, Van Heerden, Alpha Farm, and Dischem pharmacies. The formulary is on the Bestmed website. Your doctor can access that on our system, and you also got access to that. Click on your specific diagnosis, for example, diabetes. You pull off or download the formulary there, and doctor can prescribe you the medication that is on the formulary for you to avoid this 30% co-payment. Then 10 preventative care benefits that includes vaccination, female contraceptives, IUDs, the colon cancer, the pap smears, mammogram, PSA screening, HIV rapid test, baby growth and development assessments. And then at the bottom, we will see there's your PED network, the PED network member, contributions, adult dependent and child dependent. Oops, just a second. I just have a frog in my throat all of a sudden. Then bit 1, there's also your contributions for next year. And we know that the savings is not applicable on bit 1. Bit 2, unlimited hospital cover as well. The same rule applies. Please make sure that you do contact us at least 7 to 14 days before your admission. Out of hospital services are paid from your available savings. We can see here the savings account is 16% of your contributions, and that pays for your GPs and specialist consultations, supplementary services, basic radiology and pathology, dentistry and optometry. Right. Then also specialized diagnostic imaging, 23,012 Rand per family, also applicable to both in and out of hospital. Your co-payment is 2,100 Rand per scan, excluding when it is PMBs. Right. Then maternity care also covered at 100% of the scheme tariff for both your C-section and your natural birth. 6 antenatal consultations with your GP, midwife, or gynecologist. 2 ultrasounds as well. And then your take-home medication, the same rule applies here. 7 days of treatment. If it is claimed as part of the hospital account, 450 Rand to fill your prescription on the day of discharge. 27 chronic conditions are covered and 17 PMB conditions. Non-formulary co-payment as well, 30% co-payment if it is medication that is prescribed out of the formulary. Then your acute and over-the-counter medication is subject to your available savings. Then you have 13 preventative care benefits, including your vaccinations, your female contraceptives, your IUDs, colon cancer screening, pap smears, mammogram, PSA, HIV, rapid testing, travel vaccines, preventative dentistry, baby immunizations and growth and development assessments. At the bottom, we can see the B2 network contributions for next year for the main member, adult dependent and child dependent, as well as the normal B2, the non-network. Right. I just want to reiterate what is the difference between the network and the non-network options. So the network options, you are restricted. You cannot go to any hospital of your choice. There's a list of network hospitals that you need to adhere to, and you can, oh my goodness, excuse me for that, and you can go to the Bestmed website to look for the hospital that is the closest to you. All right, then, as we've mentioned, 16% of your savings go to the contributions, and the members that are on the non-network option, they have freedom of choice, right? And they pay a higher contribution compared to that of the network option. So network, no freedom of choice when it comes to hospitalization, but network, you do have freedom of choice. B3, the same rule applies here, unlimited hospital cover. The same applies for your day procedures. When you go to a day hospital, there is a co-payment applicable if you go to a private hospital for your day procedures. And we know our day procedures, as I've mentioned, is like your gastroscopies and colonoscopies, for example. Additional surgeries covered now is dental and oral, refractive eye surgery, and major maxillofacial surgery. Out of hospital services that is paid from your available savings is your GPs and specialist consultations, supplementary services, radiology, pathology, and optometry. Right. Then your specialized diagnostic imaging, there's a limit of 33,472, also combined both in and out of hospital with a 2,000 Rand co-payment for either your MRI or CT scan, and PMBs, the co-payment is not applicable. Then maternity care, we will see an increase here in the antenatal consultations, 9 here compared to 6 on B1 and B2. Then 1 postnasal consultation. All right, we would have seen on B1 and B2, there are 2, I am a bit confused here. There's only 1 postnatal consultation that is applicable here. On the other 2 options, no postnatal consultation, only the 6 antenatal consultations. Right, 2 ultrasound scans in the first and second trimester, and then your maternity supplements has gone up from 139 Rand to 145 Rand per month for the duration of the pregnancy. Your TTOs, it is subject to 7 days, limited to a maximum of 7 days. If part TTOs, you are limited again to 7 days of treatment if it is claimed as part of your hospital account. Otherwise, if doctor gives a prescription, you have 500 Rand available to you to fill your prescription. Then also applicable to you 27 CDL conditions, 17 PMB conditions, as well as 5 non-CDL conditions that are covered at 80% of the tariff. Non-formulary co-payment, 30% as well. Acute and OTC medicines, that is covered from your available savings. You also got 13 preventative care benefits, and then 15% of your annual contributions goes towards your savings account, right? Then we at the bottom, we see B3 network contributions, B3 non-network contributions, right? So member on the network option, 4,062, adult dependent, 2,898, child dependent, 1,434, compared to the non-network, which main member pays 4,514, adult dependent 3,220, and child dependent 1,593. Again, the difference between network and non-network is the difference in contributions as well as the restriction. Network cannot go to just any hospital, but must consult Bestmed or see, which network hospital is the closest to them. If there's no closer hospital to you, then you should still contact the scheme, and then we will assist you with your request. B3 Plus, right? We have introduced B3 Plus, right? We know that B3 Plus is the option that falls between the PACE 1 and the PACE 4, PACE 1 and the BEAT 4 options. The reason for that was because there was a huge jump between the two options in terms of contributions and benefits. So our members that wanted to move from PACE 1 to BEAT 4, that was a bit too big of a jump. So we had to introduce an option that is in the middle of the two, where the jump into, for contribution-wise and benefit-wise was not that huge. Right, B3 Plus, also the same here, ladies and gentlemen, unlimited hospital cover, the same 7 to 14 days prior of admission, you need to contact us. Day procedures, the same will apply if you make of a private hospital. A co-payment is applicable, then additional surgeries are covered now, such as your dental and oral, refractive eye surgery, as well as major maxillofacial surgeries. Out-of-hospital services are paid from the savings account. You will see the savings account here on B3 Plus is much higher than that of the B3 option, 25%. So we do cover your GPs and specialist consultations, basic radiology and pathology, supplementary services. Here we see there's a limit of 2,188 for the family. So we first use your supplementary benefit of 2,188 to pay for your, let's say, your physiotherapist, your podiatrist, and psychologist, right? We will first use that 2,000 Rand, and then we will use your savings account should that limit then be exhausted. Optometry every 24 months for the consultation, frames and lenses, or contact lenses, should you wish to have contact lenses. Then your specialized diagnostic imaging, your limit on B3 Plus is 36,610 Rand for the family, also both in and out of hospital, also with a co-payment of 2,000 Rand, except for the PMBs. When there's a PMB, the 2,000 Rand co-payment is not applicable. Maternity care, same here. Maternity care is covered from scheme benefits on all of the options. We'll see also 9 antenatal consultations are covered, 1 postnatal consultation, 2 ultrasound scans, as well as maternity supplements increased from 139 to 145 for the 9 months. Take-home medication when you are in hospital, the same here, 7 days of treatment as part of the hospital account, or 500 Rand if it is claimed from the retail pharmacy on that day of discharge. You also got access to 27 chronic conditions and 17 PMB conditions, as well as 5 non-CDL conditions at 80% of the tariff. 30% for your co-payment is your co-payment for the use of non-formulary medicine, and your acute and OTC meds, those are available also or payable from your savings account. Right, then you also got access to 13 preventative care benefits, as I've mentioned on the other options. And at the bottom, we'll see B3 Plus, 5,042 Rand for the main member. Adult dependent, 3,746. And child dependent, 1,902. Beat 4. Same rule applies here, ladies and gentlemen. Hospital cover, the stay, the therapies, consultations, surgery, procedures, scans, all of that is covered at 100% of the scheme tariff. Your day procedures, the same rule applies here. Additional surgeries covered, the same dental and oral, refractive eye surgery, as well as major maxillofacial surgeries. Then out of hospital services, those are paid from your available savings account and your day-to-day account, right? So on the beat 4, there's a difference between the beat 1, 2, and 3, and beat 3 plus to that of the beat 4 in the PACE options. They have a day-to-day account and a savings account. So we first use your savings account to pay for, example, out of hospital consultations like your GPs and specialists, for example, basic dentistry, etc. And then thereafter, if that limit is depleted, we then start using your day-to-day account. The day-to-day account is, there's a specific limit for the overall day-to-day account, and then you get in that day-to-day accounts, there are specific limits applicable to certain things in your day-to-day account. Right. So for that, ladies and gentlemen, you need to go to your comprehensive guide, look at your day-to-day and see what the subcategories are for those. All right. So there will be a subcategory for your consultations, for your medicine or acute and OTC medicines, for example. Let me see what dentistry, there will be sublimits on those. So everything that is to do with out of hospital stuff. Right, then what has been added, like we said, not added, but increased here, is the hearing aids, right? 13,357 per family every 24 months, cochlear and bone anchored hearing aids, 250,000 per beneficiary per annum, and then the specialized diagnostic imaging, MRI and CT scans, those are limited 41,840 for the family, both in and out of hospital, also with a 2,000 Rand co-payment, except in instances of PMB cases. Then your PET scan, 1 per beneficiary per annum, and it's not subject to the co-payment or limit, right? So it is not subject to the 41,000 Rand that you have for your MRI and CTs. Maternity care, the same rule applies here, 9 antenatal consultations, 1 postnasal consultations, 2 ultrasound scans, maternity supplements at a 445 Rand. Your TTOs, the same rule applies here, but on beat 4, the TTO limit increased to 550 Rand compared to that of beat 3 plus of 500 Rand. Also 27 CDL conditions, 17 PMB conditions. Here on beat 4, 9 non-CDL conditions covered at 90% of the Bestmed tariff, 20% co-payment for your non-formulary medication. Your acute medicine is subject to your savings, and then the sublimit, right? And then OTC, your savings is up to 1,214 Rand. So if on your OTCs, you do have, it is covered from your savings account up to 1,214, then you do have access to your full savings account should you need to, but you will have a self-payment gap if you ask us access to your savings account to increase your OTC medicine benefit. And you have to contact the scheme to open up your savings account should you need more savings available for your OTCs. Also, 13 preventative care benefits are included here. And then we can see here on bid 4, 14% of your annual contributions go towards your savings account. And then we will see there the contribution per member is 7,365, adult dependent 6,082, child dependent 1,821 rand. Overall day to day, if you're a single member, 16,227 rand. Then for the family, 32,452 rand. The PACE range. The PACE range offers our members access to a savings account as well as a day-to-day account for all of your out-of-hospital needs. It also includes 29 additional chronic conditions that are covered, for example, the osteoarthritis, motor neuron diseases, Alzheimer's, and ADHD, for example. Then changes to the PACE range. Right, so the limits here has also been increased to 550 on PACE 1, PACE 2 and 3 to 600 Rand, and PACE 4, 700 Rand for your take-home medication when you've been hospitalized. There's an increase in the cochlear implant and bone-anchored hearing aid, PACE 1, 250,000 Rand, PACE 2, 285,000, PACE 3, 320, and PACE 4, 350,000 Rand. Then breast reduction surgery, a new maximum limit for breast reduction or surgery on PACE 4, all right. So that has a new maximum limit there added. It's been added now on PACE 3, the breast reduction surgery, which is wonderful news. So the new maximum for breast reduction surgery there's a limit of 100,000 Rand per family, including the fees for all of the service providers, the hospital, and the procedure itself. Then also changes for next year, there's a combined knee and shoulder replacement limit. The shoulder replacements are funded from the same limit as that of the knee replacement and are only covered on PACE 2, PACE 3, and PACE 4. On PACE 1, it will be covered and apply only if the procedure qualifies as a PMB condition, right? So that is the only time that your knee replacement, shoulder replacements, those things will be covered on PACE 1. That is if it is a PMB condition. Right, further to that, the IUD, we've mentioned it earlier on, it is now a separate benefit. There's a limit of 4,225, and it is covered every 5 years or once every 5 years. Then colon cancer screenings, that has been added also every 24 months for beneficiaries 40 years and older. Then the HIV rapid testing as a preventative care has also been added and paid once every 12 months at a designated service provider pharmacy. And the PSA screenings, the limit or the age limit rather, has now been reduced to 45 on all of the PACE options. And here we can see the difference between the oral contraceptives or the normal contraceptives rather, compare that to the IUD, right, IUD, intrauterine device, on the different options we can see here. Right, an overview of PACE 1, the same applies here. Hospital is covered at 100% of the scheme tariff. Also, all of the PACE options, you must contact us 7 to 14 working days before your admission. Your day procedures as well, there is a co-payment applicable. Should you need to go for gastroscopy or colonoscopy or any day procedure, right? And there are day hospitals that is on our network, so please consult us or go and have a look on our website. And then additional surgeries covered now: dental and oral, refractive eye surgery, as well as maxillofacial surgeries. Out of hospital services are covered first from your savings account, then from your day-to-day account. Your savings account forms 19% of your annual contributions. And we know that the savings account on all of the Bestmed options are given on the 1st of January. Right, it's been given upfront. So if you're going to leave the scheme in the middle of the year or sometime towards the end of the year, you must be wary that we have given you on the 1st of January access to your entire savings. So if you leave the scheme a few months after the year has started or before the year ends, you will be owing the scheme savings money should you have used up all of your savings. All right, just a word of caution or something to keep in mind when you decide to leave the scheme during the course of the year and you've used up all of your savings account. There will be a clawback. Right, then, ladies and gentlemen, also here covered on page 1, optometry services every 24 months, hearing aids, 10,123 for the family, cochlear and bone-anchored hearing aids, 250,000 for per beneficiary per annum, and your MRI and CT scans, 41,840 for the family, a 2,000 Rand co-payment. Your PET scan is not subject to that 41,000 Rand. And also the co-payment is not applicable here for your PET scans. Maternity care, exactly the same here as we've mentioned with all the other options, be it for example, 9 antenatal consultations, postnatal, ultrasounds, and the maternity supplements. Also remember what I've forgotten to mention here is that you can contact us to belong to the maternity care program, and we give advice and we walk the journey with you while you're pregnant. So it's a very nice program. Please join it should you maybe want to fall pregnant, or if you are pregnant, please contact us. Then the same with our TTOs here on page 1, also 7 days of treatment or 550 Rand for your prescription, 27 CDR conditions, 17 PMB conditions, plus 7 non-CDR conditions that are covered at 90% of the scheme tariff, a 25% co-payment for non-formulary medicine. Your acute medicine, we will first use your savings account, then your sublimit. OTCs, there you have 1,214 to your disposal. You also got access to use your full savings or part of your savings should you need to, and be again mindful of the self-payment gap. Then there's 13 preventative care benefits to your disposal as well. And the limits for contraceptives, as we mentioned, has been updated or increased to 2,801 Rand. And then the IUDs, then the HIV rapid test, which we have already mentioned. Then the contributions on your left-hand side. In the middle, there are 13,794 for your overall day-to-day. And the family overall day-to-day is 27,586. And like I've said earlier on, 19% for your savings. Right on page 2, the structure is exactly the same. The rules are exactly the same, ladies and gentlemen. You will see the orange highlighted. Those are where the changes or the enhancements have been made. For example, the cochlear and bone-anchored hearing aid, that is 285,000 Rand there. Your diagnostic imaging or your MRI and CT scans, that limit there is 43,932 for the family. Also both in and out of hospital. And your PET scans as well, only one PET scan, not subject to the co-payment and not subject to that limit of 43,000 Rand, and PMBs are excluded, all right, when you need an MRI and CT and it is a PMB. Also, maternity care benefits, exactly exactly the same here. Your take-home medication, also exactly the same. Your chronic and PMB is exactly the same. You have here for your non-CDLs, 20 additional non-CDL conditions. A list of those non-CDL conditions is in our comparative guide. 90% of the tariff is paid here. 20% for making use of non-formulary medicine. Then the same applies. Acute medicine, first savings, then the supplement OTCs, the same applies, your 1,214, or you have access to your full savings account. Biological medicines, there's a limit there of 210,208 per beneficiary per annum. All 15 preventative care benefits are available to the PACE 2 members. And then we can see the contributions here at the bottom on your left, in the middle, your overall day-to-day limit that is subject to sub-limits once again, and then 14% of your contributions goes into your savings account. PACE 3 as well, 14% here, as we can see on our right-hand side, goes into your savings account. Savings is given up front. Any unused savings will get transferred into your vested account on all of the on all of the PACE options, as well as the BEAT 4 options. The B2 and B3 options, those get transferred into your normal savings account. But for the PACE options, you get a vested savings account. All right, for any unused savings that you might carry over to next year. Hospital, ladies and gentlemen, the very same year. It's going to sound very repetitive if I need to say all of that again. The out-of-hospital services, also going to sound very repetitive. First your savings account, then your day-to-day sublimits is applicable. The medically necessary breast reduction has been introduced. The surgery limit of 100,000 per family. Optometry every 24 months as well. Your hearing aids, 33,472 every 24 months for the family. Then your cochlear and bone anchored hearing aids, 320 per beneficiary per annum. Your MRI and CT scans, the same rule applies here with a co-payment of 1,500 Rand. Maternity care, the very same rule. Your take-home medication after hospitalization, the very same rule applies, but your limit is increased PACE 3 to 600 Rands. Then you also got access to 20 non-CDL conditions covered at 90% of the scheme tariff, 15% for the use of non-formulary medicine, acute medicine, same rule applies, OTC, same rule applies. Biological medicines, the limit here, 420,695. Your contraceptives, and it's the same rule applies. It's either your normal contraceptives, which is the oral injection or patches or whatever it is, and then separate is the IUD, which is inserted once every 5 years. And then you've got access to all 15 preventative care benefits. Your contributions is here at the bottom, as we can see. Contributions on PACE 3 member, 10,064, adult dependent, 8,101, a child, 1,731. Overall day-to-day, if you're a single member, 23,028. If you're a family, 590 Rand. PACE 4, here, a bit of a difference, all right? So PACE 4 has mostly scheme benefits and overall day-to-day benefits. Like your hospital covers unlimited scheme benefits, same rule applies there. Out of hospital, we first will pay from your day-to-day, and then, all of it will come from your day-to-day account. So that's the difference between PACE 1, PACE 2, and 3. PACE 4, everything is covered from your day-to-day account. That is for out-of-hospital, such as GP, specialist, supplementary, basic radiology, pathology, your dentistry, for example. Glucose flush, that is 30,357 Rand for the family. Your insulin pump and consumables, those are excluded. And insulin pump excluding the consumables. All right, that is now for your glucose monitoring devices, right? Then 53,143 per beneficiary per annum every 24 months for medically necessary breast reduction. 100,000 limit here for the family. All right, then your cochlear and bone anchored hearing aids, that is 350,000 per beneficiary. MRI and CT scans, 47,070, 1,500 for your copayment. Then we see also maternity care, exactly the same. Your take-home medication, here the difference is only the 700 Rand claimed for your prescription at your retail pharmacy. Then the difference here also is you've got access to 29 non-CDL conditions covered at 100%, and then 10% co-payment for the use of non-formulary medicine. Acute medicines also paid from your overall day-to-day or from the day-to-day limit. Then OTCs, your OTCs will be covered from your 3% savings account. Biological medicine, 622, 628 Rand. Same rule applies here for your contraceptives, for your colon screenings, and you have access to all 15 preventative care benefits. Right, then our rhythm option, Rhythm 1, our entry-level income-based plan offering a variety of unlimited primary care day-to-day with in-hospital benefits at affordable contributions. Rhythm 2 offers more comprehensive hospital benefits than that to the Rhythm 1 option. And in addition to unlimited primary care day-to-day benefits. Changes on Rhythm: increase in the take-home medicines, as we have mentioned already. 450 Rand is now the increase there for your take-home medicines. Adenoidectomy was added to the day procedures, all right, and the procedures are covered on the Rhythm 1 option only. Then separate, okay, again, the contraceptives benefit. All right, as we've mentioned already, there's the limit for your oral contraceptives and your IUDs. Then the cancer, the colon cancer has also been added here. The HIV rapid testing here has also been added. The PSA screenings here as well, right? That's been added to Rhythm 1, and then the age limit has been lowered from 50 to 45 years old. An overview of Rhythm 1, unlimited PMB hospital cover. All right, take note, unlimited PMB hospital cover. You must phone us for authorization. Also, the network options, there are co-payments for the use of non-DSPs, right? So if you're going to your own hospital, private hospital that is not on the Rhythm network, there are co-payments applicable, especially with hospitalization of 15,025 Rand for your day procedures as well. If you're going to go to any other designated service provider, there as well, there are also co-payments applicable. Then 57,441 for the family per annum at a day hospital for your circumcisions, colonoscopies, gastroscopies, etc. Those things that list is here, and what has been added to that list is the adenoidectomy, as I've mentioned. Unlimited GP consultations subject to your Rhythm GP network. Pre-approval is needed after the 10th visit. Your pharmacy clinics and nurse consultations, there is unlimited primary care nurse consultations at network pharmacies. Specialist consultations, 2,670 for the family per annum, subject to, again, the Rhythm specialist network. You must be referred by your Rhythm network GP, all right, to go and see the specialist. Then the day-to-day services on the Rhythm network providers, those would be then your basic radiology and pathology, basic dentistry and optometry on eye test there. Maternity care, paid from the scheme benefits, right? You've got 6 antenatal consultations and 2 ultrasound scans available. Your TTOs, the same applies here. The limit now have been increased to 450 Rand, then 27 chronic conditions and 17 PMB conditions with a 30% co-payment for non-formulary meds. Acute medicine, unlimited, so it is covered at 100% of the scheme tariff, subject to the Bestmed formulary from the DSPs. Okay, OTCs, 251 per family per annum and 125 Rand per event. You've got access to 11 preventative care benefits. Right, and at the bottom, we can see the income contributions category band. So between category 0 and 9,000 Rand, that is your contributions for 2026. Income bracket between 9,000 and 14,000, that is your contributions for 2026. And then 14,000 plus, that is then for those members for the 2026 year. Rhythm 2, unlimited hospital cover, right? The hospital stays the same. You must also please consult Bestmed before you get admitted. Day procedures also covered, right? You must please make use of designated service providers, otherwise there will be co-payments. There are unlimited GP consultations subject to your Rhythm GP network. The same with your specialists. Also, the Rhythm specialist networks are applicable. Then if you are a single member, 1,822 to your disposal. For a family, 3,037 to your disposal for a specialist consultation. Radiology and pathology are subject to the protocols, approved codes, and referral is required by either your GP or a specialist. And then your scans, you've got a limit of 18,828 for the family for both in and out of hospital with a 2,600 Rand co-payment. And maternity care, here on Rhythm 2, you've got 9 antenatal consultations, 1 postnatal natal consultation. I keep on saying postnasal consultations because I have a postnasal drip. That's why I've been coughing. So I keep on saying postnasal instead of postnatal. So please forgive me, ladies and gentlemen, because of my postnasal condition that I'm suffering with currently. 2 times ultrasound scans, first and second trimester, maternity supplements at 145. Your take-home medication, the same rule applies with 450 Rand. If claimed from your retail pharmacy, then over-the-counter medicine, 366 for the family, or 122 Rand per event. You've got access to 12 preventative care benefits. Then income categories 0 to 5,500. The second or middle income category, that is 5,501 to 8,500. And then 8,500 and plus, that at the bottom on your right, that will then be your 2026 contributions, monthly contributions. Right, summary of the 2026 enhancements for those of you that have joined us late. Adenoidectomy for both adults and children is now covered on Rhythm 1. PSA tests have been added to Beat 1 and Rhythm 1. That is, it has been available on all of the other options except on those. Preventative care for facial occult colon cancer or colon screenings, that has been added to the preventative care. And then introduced cover for medical necessary breast reduction, that's been introduced on PACE 3. Then the shoulder prosthesis will now be paid from the knee prosthesis benefit, so that will be a combined benefit. Then preventative care, HIV rapid test has been added now. Then PSA screenings, the age there has been minimized from 50 to the age of 45. Increased limits on the cochlear implants and BAHAs, increase all over limit for the medical and necessary breast reduction on PACE 4, so that has been increased. And then there's also the introduction of the separate limits for your contraceptives and IUDs, as well as the increase on the take-home medication. Right, and our contributions, this is just an overview of what I've already explained to you. There you'll see the percentages of your annual savings account, and you will see the contributions, the monthly contributions on beat, pace, and rhythm. Additional benefits that the scheme offers, right? Your flu, HPV, HIV vaccines, travel vaccines, pneumonia vaccines, HPV vaccines, contraceptives, pap smears, mammograms, and the others we have already mentioned. And here we will see out of all of the 15 preventative care benefits, where there is a right tick, it means that those are covered on your option. For example, on beat 1, you will see there is just a little dash there by travel vaccines. The dash there means that the travel vaccines are not covered on beat 1, for example. Right, you will also see on beat 1 another dash there for pediatric immunizations, preventative dentistry there on beat 1, bone density, glaucoma screenings. Those are dashed and not the green right mark. So it means those are not covered when you look at your benefits or trying to understand what your comparative guide is telling you. Managed care benefit, oncology, that is still administered by ICON. You must, when you are diagnosed with any PMB condition, please contact us. There are forms that you need to complete. You must fulfill in the forms for your chronic medicines or your chronic conditions and your PMB conditions. Very important that you complete the forms when you're newly diagnosed, even with your HIV. So HIV, that is still managed by LifeSense. Your stomach care, that is Bestmed. Your back and neck procedures, that would be workability. Then there's also your dialysis, maternity care, wound care, and your substance abuse benefits, right? This is just an overview of your maternity care benefits, as I've already mentioned, so we will not go into detail again with that. Then the medical travel insurance cover, right, when you will be traveling overseas, right? So we do know that you must please contact the scheme, or you can contact ER24 with leisure travel that is limited to 90 days and 90 days limit, 5 million rand per beneficiary. That is for both members and dependents, with a limit of 1 million per family when you're traveling to the USA. 60 days is covered for business travel, right? Then 5 million for the family, and also 1 million if you are traveling to the USA. Then business and leisure travel, pre-existing medical conditions, right? That is covered 250,000 Rand if you become ill due to a sudden or unexpected acute onset of a pre-existing medical condition as an inpatient while you are on holiday or on business, when you are hospitalized. Then, please, ladies and gentlemen, what we should remember is there are limits, accesses, and terms and conditions that you need to read through. When you speak to the consultants, please ask all of your questions. Read through the policy documents. It's very important so that you can know the do's and the don'ts when you are traveling. The Tempo Wellness Program, for those of you that don't know, Tempo Wellness is free of charge for all of our members. You have to complete your lifestyle screening to unlock your benefits to the dietitian or to the biokineticist. You will get 2 consultations after you've done your Tempo lifestyle screening. It can either be a face-to-face or a virtual, but we prefer your first consultations to please be face-to-face, because for your nutritional with the dietitian, she has to do an in-body scan. She has to ask you certain questions and get an overall view of your health and well-being. And then the second one can then be a follow-up. However, I would also suggest the second one to be also face-to-face should you had certain goals, like maybe losing weight or increasing your muscle mass, or just being healthier and so on, for that face-to-face consultation. But it is virtual as well for your convenience. Your biokineticists, right? Your first one, we also suggest face-to-face for your movements and exercise plan, etc. Then the second one can be a virtual or a face-to-face one. Then the Temple Wellness Program also have monthly webinars where we explain and we invite speakers to come and talk to us about certain conditions. On the Bestmed website, there are a lot of information with regards to healthy eating, exercising, mental health, emotional health, depression, whatever it is that you may need from the scheme. Right, the next steps. What do we do? Right, the next steps is that, like I've mentioned earlier on, you need to consult the Bestmed website to see where and what are all of these service providers that Loretta has been talking about. They are nationwide, so in your area, there should be a contractor, GP, a specialist, a hospital, a day hospital. Have a look at the Bestmed website, or you can WhatsApp us, or you can phone us or email us for that information. Child-dependent rates, up to the age of 24 years old. No self-payment gaps. We do not have any self-payment gaps or thresholds, unless, like I said, you want to use, for those on the PACE options, all of your savings account for OTCs, then you will have a self-payment gap. No GP referral is required for a consultation to the specialist, except if you are on the rhythm options, all right? And then only pay for up to the first 3 children, right? Except for the rhythm 1, right? And like I said, child dependence rates are paid up to the age of 24 years old. Then up to 16 preventative care benefits, right? Then maternity benefits as mentioned, then international travel cover to your disposal, then the Bestmed app. The Bestmed app, please download it if you don't have it. It gives you access to submit your claims, to look at what is your savings account, also the different service providers, etc. The Tempo Wellness Program is also on there. So a lot of information that you can see on the Bestmed app without having to phone us, right? Then the option change process, that is that time of the year now, right? What do I need to consider when I want to change my option? Do I have a high risk treatment, right? Was I newly diagnosed? Is my procedure or my diagnosis disease covered on my current option? Will I need to go to hospital, for example, if I'm on the beat options or phase 1 option? Will I need a knee replacement or a shoulder replacement? I need to consider that. Is that covered on my current option? Right, the freedom of choice, if you're on a network option, right, it does not work for me. I don't like these network providers. I rather want to go on the non-network option. Your chronic conditions, does my current option cover my chronic conditions? The medicine as well for your chronic and PMB conditions, right? Your savings account, is that enough for you and your family? And availability of your benefits, for example, your savings and your day-to-day account, if that is depleted middle of the year, and you say, okay, now so this option did not work out for me, do I need to speak now to my broker or my key account consultant or my Bestmed business consultant? Who do I speak to? Right, so like I've mentioned already, when you need some joint replacement or newly diagnosed chronic or PMB conditions, you need to consider co-payments and non-formularies as well as if you are not utilizing your savings or your day-to-day account, then you can also then ask your broker or your key account consultant to assist you with your option change. Right, the cutoff date, we know that most employers, corporate employers, their cutoff dates is earlier than that of Bestmed because we know the employer closes for the holidays, right? Speak to your HR. Your HR should be telling you our cutoff date is, for example, the 10th of December. Your option change should have been made by then so that your HR can sign off on it and submit it to Bestmed. If you're an individual member, right, you do have until the 31st, but I would also suggest very, very early before you go on holiday, send in your option change form so that it is effective from the 1st of January. We do not allow option changes during the year unless it is for a newly diagnosed condition. And especially, in cases of PMBs and so, those will be considered, those will be sent to our medical advisors for their opinion. Yes, can we? No, we can't. So it's very important for you to make that informed decision now already. Right. Then you would see at the bottom, which I've been spoken about earlier on, if you are on the bead options in phase 1, joint replacement surgery has not been permitted since January 2023. If you know that you are suffering with a knee or any joint problem, please speak to us, speak to your consultant. Right. Ladies and gentlemen, we did come to the end of our presentation. I hope that you have bombarded my panelists with all of your questions. We will take 3 minutes for you to complete the poll right now. Please tell us, was the changes of 2026, is it good news to you? Is it bad news to you? What is it that you don't like about the changes? What do you suggest even to us? All right. And if you have personal questions, like I said, you're welcome to email us at engagements@bestmed.co.za so we can give you a full and comprehensive answer.